or slightly higher. Not too much, just about an inch or so higher, or at the same level as your hips are. That is about the sitting position. You have to sit straight. And the second is that there should be at least 3 hours gap before you have eaten or drink anything, before you start doing the pranayama. So that is the best time to do the pranayama is the morning time when you are empty stomach. Now, what is a pranayama? Pranayama, generally people think it is a breathing exercises. Indirectly, you can say the breathing exercises, but directly it is not. It is the control of the prana. The pranayama, number one, let me reiterate, it is not pranayam, it is a pranayama, the correct pronunciation in Sanskrit. If you are pronouncing in Hindi, then pranayam is fine. But in Sanskrit, it's pranayama. And it is a combination of 3 small words. First word is a pra, second word is na, and the third word is a ayama. Pra means first or the supreme. Na means energy, and ayama means control or management. So we are controlling the first energy or the supreme energy. What is supreme energy? Supreme energy is the cosmic energy. Everything our body is doing or anything in this world, universe, is a machinery or anything, it is moving, it is the cosmic energy. And that is, the prana is part of the cosmic energy. So the management of the cosmic energy is pranayama. By how we do that, we do by breathing exercises. Now, to breathing for the, as you know, that for the breathing you need the lungs. And the lungs has 2 lungs, right and left, and each has 3 lobes, 3 parts. Upper, which is above the collarbone over here, and the middle in the chest, and the lower in the lower part of the chest. And normally, average person, average adult, I will say, that the breathing is the chest breathing. And that is because of the stress. If you have seen a newborn baby, or a few weeks or even a few months old baby, and if you observe carefully, the baby's abdomen will be moving up and down. Because of that is the abdominal breathing, that every time the baby breathes, the abdomen goes out. Every time baby breathes out, abdomen goes in. And that is because the baby has no stress. And as the baby comes in this world, starts getting stress because of the weather or the blanket pinching or whatever reason, and that this abdominal breathing shifts from the abdominal breathing to the chest breathing. So that is one we have to learn how to practice the pranayama to abdominal breathing. And what is a yogic breath? Yogic breath is combination of the abdominal, chest, and the apical. Apical is the apex breathing, which is above the collarbone, a very small part of the lung. So we have to combine all these 3, and that is a full yogic breath. But the most important is the abdominal breathing. Because abdominal breathing is a deep, and chest breathing is compared to abdominal breathing is very superficial. And the abdominal breathing being deep, and when you breathe, breathing rate will be slow. And because of deep breathing, and you have a less stress. While the chest breathing causes the stress, is a fast breathing, the chest dive. The abdominal breathing will stimulate the parasympathetic nerves as compared to the sympathetic nerves. The parasympathetic nerves are relaxing nerves. The typical example is the vagus nerve, which starts from the head and goes all the way to the heart, lungs, and abdominal organs, and to the pelvic organs. And that is the relaxing nerve. Now, there are various kinds of pranayama. Let me ask you one thing. If you have any question anytime during my talk, you can stop me and ask the question. Do not wait till the end because you may forget the question. Now, starting the breathing, we have to combine these three types or three segments of the breathing: the abdominal, chest, and the apical breathing. That is fundamental. And there are various kinds of pranayama. The basic is what we call nadi shodhanam, or alternate nose breathing. That you breathe from. Dev Ketu, one question. You want me to demonstrate these or just theoretical aspects?
I think theoretical will be okay. And if the audience get to know about the bones, how we can keep them healthy by pranayam and yoga. So that will be great.
All right. Okay, so theoretical aspects of the pranayama. Good.
So we have a question.
Yes.
Yeah, Dr. Gandhi, I mean, it's not related to pranayama, but since like you're orthopedic, so I have a question regarding my shoulder surgery. So can I ask now or should I wait for the pranayama session to be end?
That you can ask at the end.
At the end, okay.
And the other question is, like you mentioned, we have to empty stomach. Even water also not should be drank 3 hours before that.
No. If you ever take a sip or so, that is fine, but not the too much water either.
Thank you.
I think demonstration will also be good, but at least for some of the important ones.
Okay, so I will just give a brief alternate breathing demonstration that you put these two fingers, index and the middle finger, on the forehead middle where the ladies put the bindi. Thumb on the right side of the nose and the ring finger on the left side of the nose. By gentle pressure, you, with the thumb, close the right side of the nose and breathe in from the left side. And when you finish breathing, then with the ring finger pressure, close the left side and breathe out from the right side. And after breathing completely, then breathe in from the right side and then close the right side and breathe out left side. That is one pranayama. You should do at least 5 pranayamas like this. Yeah. Now, when doing this kind of pranayama, the breathing should be smooth. There should be no jerks. One continuous breathing, and there should be no pause, and it should be silent. The person sitting next to you should not hear your breathing sounds. And the other is simple pranayama, is the Ujjayi breaths. Ujjayi breath is, Ujjayi means the ocean. And if you have been on the seaside, standing there on the sea, and it's a windy day, and you hear that sound, or if you're in Manhattan and you're passing between the two streets, and there is a windy day, and you hear the sound blasting that sound is, that's what we have created, that kind of sound in this breathing. How we do that? Simple ways, I will show you that. Suppose this, my finger is a candle. How you blow it? To blow it, you will take a deep breath, and then you will forcefully, you put that what you did that? You did three things. You took the deep breath, you closed your back of the throat partially, not completely, and then forcefully you blew it. So that is creates the sound. Now that we have to do from the nose, not from the mouth. Then you take a deep breath and close the throat partially and then forcefully blow. Like that. So that is the Ujjayi breath. Ujjayi breath we practice when we are doing the asanas. Doing the asanas or any other exercise, we should try to practice Ujjayi breath, but it prolongs the breath. And the third kind of the breathing, which I want to discuss, the Brahmari Pranayama. These three kind of, that is the alternate nose breathing, the Ujjayi breath, and Brahmari Pranayama can be practiced by anybody, irrespective of the individual's health. There are further pranayam which I'm going to talk. Those cannot be practiced by everybody. There are some contraindications. As we go, I will talk about that. Now, how we do the Brahmani Pranayama? You take a deep breath and close your lips and keep your teeth, upper and lower teeth, slightly open, and then blow the sound, and your hands are like this. With the thumbs, you are pressing the ears to close the ears completely, and the fingers are on the side of the nose and on the middle of the forehead, and you blow the sound and create a sound like a bumblebee. I will show you now how it is done. Got the idea? That's the way to, is the Brahmari Pranayama is done. Now, what is the benefits of the pranayama? The general benefits is that the capacity of the lungs is 5 liters or 5,000 cc's. Average person uses only 1/10 of it, only 500 cc, average person. That is in the male, female is little less than that. So with the pranayama, that we are increasing the capacity of the lungs and we are using more and more air. That is a better oxygenation, and that helps all the organs of the body. And the second is that, as I mentioned previously, that abdominal breathing is the most important, the lower part of breathing, abdominal breathing, which is, although is misnomer, really it is diaphragmatic breathing. That in the lower part of the pneumonia starts in the lower part of the lungs, because normally average person breathes by the chest breathing, and much oxygen does not reach in the lower part of the lungs. So that is why the bacteria has time to grow there. So that causes the pneumonia. And then the apical part I mentioned about that, about the collarbone, that is important, because there also the enough oxygen does not reach, and the tuberculosis starts there in the upper part of the neck. Now, pranayama reduces the stress. I said already, and it lowers the blood pressure, it lowers the heart rate. So those are the general benefits of the pranayama. Now there are specific benefits of the Brahmari Pranayama, which I will talk little in detail. Now Brahmari Pranayama, did the EEG, electroencephalograms of the average person, or even of the yogi, the four kinds of waves can be, four waves at a different frequency can be generated. Number one is the beta waves, when the person is awake, completely awake, and the frequency of the waves is between 14 to 40 hertz. The second one is alpha. Alpha is the frequency of the waves is between 7.5 to 14. And that is a meditation stage. Now, after the alpha comes the theta. Theta is 7.5 to 4 frequency. And then lastly is the delta. That is 0.5 to 4 hertz frequency. Now, these are the waves present in an average person. Average person, even who is doing the pranayama. But with the Brahmari Pranayama, there is another wave comes called the gamma waves, which is normally not present in the encephalogram. But the only person who has practiced enough Brahmani Pranayama will have the gamma waves. Gamma waves are anything above 40 hertz. Now, what is the benefit of these? That the roof of the nose and roof of the palate as the basis or the base on which the part of the brain rests. In the roof of the nose, prefrontal lobe rests, and in the roof of the palate, the temporal lobe or the hippocampus part of the rest. That now the sound travels by vibrations. That is a well-known fact. I don't have to explain that. Now, when we block the ears, the sound is being produced, and that is traveling through the bone of the roof of the nose and the roof of the palate, because those two bones, the roof, are very thin. Sort of, there are multiple holes in them, even they are very thin, so the vibrations can go very easily. So it stimulates the prefrontal lobe and hippocampus. Now, prefrontal lobe is involved with the stress, so it reduces the stress. And the hippocampus is for the memory, so it stimulates the memory and the cognition. And the other benefit is that the lining of the nose and the sinuses contains the nitric oxide gas. That is a normal gas present in the lining of the nose and the sinuses. When we do this Brahmari Pranayama, that gas is released, and that goes into the circulation. The nitric oxide function is to dilate those blood vessels, and thereby it reduces the blood pressure also. So that is the big advantage of the Brahmani Pranayama. So I strongly recommend that it can be done by every person without any contraindication. It should be done.
Hello, Dr. Gandhi. This is Neeru. Can I ask you a quick question?
Yeah, sure.
Excellent talk on pranayama and how they benefit us and what is their positive impact. Wondering, like, I was personally very, very eager to hear about bone health, because I have a severe backache issue. I have herniated disc, and I do have bone issue, means my lower back pain and all kind of, I think since I have hit my 45, I have issues all over my body. My bone aches a lot. So I was wondering if you could please, such as knees, my shoulders, my back. I feel every part of my bone actually ache. It started aching since I hit certain age. Wondering, like, if you could please guide me, like what should I do to keep my bones healthy? and what others should do, whether related to pranayam or medically, what happens to our body? Anything if you could cover in that sense.
Okay, I'm coming to that. So
All right. Thank you so
I'll,
very much.
I'll be coming to that. Okay, so with the Brahmari Pranayama, there's a higher cognition, higher memory, and reduced stress. And it also improves the hearing. If somebody has slight defect in the hearing, this will improve because the bone conduction will be improved. And if somebody has a tinnitus, that is a how to, in a layman term, that ringing sounds in the ears. If the ringing sound comes from time to time, it will lower that also. And normally, average person is releasing the hormones, which are adrenaline, the histamine, cortisol, and inflammatory cytokines. You must have heard these. They have a lot of name the cytokines in the public, in the literature, in the internet and the news, because the COVID. But when you do the pranayama regularly, that these hormones will not be released that much. Their quantity will become less, and instead the other hormones, which are growth hormone, dopamine, serotonin, oxytocin, endorphins, melatonin, alpha amylase, and GABA, these hormones will be released, and they again reduce the stress and the blood pressure and the heart rate. So those are the general benefits. Now I'm coming to the bone health.
I have a quick question.
Yes.
How long should one practice in a day? Like for how many minutes, or is there an ideal amount of time that one should practice to really reap the benefits of doing this?
It depends on the individual capacity. And you should start from the 5 to 10 minutes, and then gradually you can build it up. One thing I missed one thing. So according to Patanjali, you know, the Patanjali is named that who is considered to be the father of the yoga. According to his book and his writings, the pranayam is not pranayam unless it is accompanied by retention of the breath, the holding the breath. So there are three phases of the breath: breathing in, inhalation; breathing out, exhalation; and the holding the breath, retention. Retention is a Bahi retention, that if you are holding the breath out, and the internal rotation if you are holding the breath in. I did not mention these purposely because these are not suited for everybody. Anybody who has a heart condition, uncontrolled heart condition, or uncontrolled blood pressure, or glaucoma, or any other significant eye problem, or you have the hernia, or in the ladies prolapsed uterus, should not do this retention of the pranayamas. They should do simply breathing in and out. Okay, now coming to the bone health.
Dr. Gandhi, I have one question.
Yes.
The pranayam should be done in sitting position on a chair, or it be done laying on a flat floor or standing position?
It should be done in sitting position, either on the floor, like a meditated posture, Sukhasana or Padmasana or Vajrasana, any whatever you feel comfortable. If one cannot sit on the floor, it is okay to sit on the chair. The chair should be firm, not sofa or cushiony chair. And one should not rest on the backrest. Sitting straight, the spine should be straight and free. And the knees should be at the level of the hips or slightly higher. Does that answer your question?
Yes, sir. Thank you.
Okay. Now coming to the bone. Now, when the person does the pranayama, there are some chemical changes in the blood. That there's increase in the calcium in the blood, decrease in magnesium and total proteins. And albumin and globulin ratio changes also. But there is no osteoblastic activity. Now, what is osteoblastic activity? That in the bone is a living tissue. And there are constantly, there has been changes happening in the bone without you knowing that the old bone is being eaten by the cells called the osteoclasts. And the new bone is being replaced by the osteoblasts. Now with this pranayama, as I said, there are changes in the blood, which has been recorded by experiments and on the volunteers, and which are favorable for the bone building. But there is no osteoblastic activity noted. So this is not somewhat contradictory statements, but that is all I know about this part. But now you know the osteoporosis. What happens in the osteoporosis? Osteoporosis is more common in women, and it actually starts right at the age of 25, 30. But at that time, it is at a very, very slow speed. But as they progress in age, especially women, because of the menopause, because of the lack of estrogens, this process speeds further. That the bone is being eaten up by the old bone is being eaten by the osteoclast cells, but is not being built by the osteoblasts, because that hormone which needs to build is missing. So the men also, they get the osteoporosis, but little later, and the progress is slow. And this is one cause, that the menopause and the lack of the estrogen. Another cause of the osteoporosis is the condition called sarcopenia. That means the loss of muscle. At the age of 25 or 30 or so, at that age, if the person is not doing any physical exercise, the person, whether it's a male or female, irrespective of that, will be losing about 0.25%, 0.25% of muscle mass every year. Roughly, so in that age, in a decade, in 10 years, the person will lose about 3 to 4% of muscle mass. That is up to age 40 or so. After age 40, the muscle mass losing becomes more faster. It becomes about 0.4 to 0.5% per year. And at age 60, you're losing almost 0.75%. And 70, you are losing 1% of muscle mass every year. So now to have the bone strength, if the muscles are weak, because the muscle put traction on the bones, that stimulates the bone formation. If that traction by the muscle is not there, the new bone is not formed. And of course, with these things that the diet is important, that should be rich in calcium, the vitamin D, and proteins. Because the network of the bone, the main bone is formed by the osteoblast with the proteins, on which the calcium is deposited to to give the strength of the bone. So that is about the osteoporosis, because there is no conclusive evidence whether the pranayama alone helps or not. Now they did another experiment that they compared the same blood results and the osteoplastic activity in the healthy athletes or healthy volunteers of a similar age and sex, and that who did the aerobic exercises and the similar under the control, and in those cases there was no those blood changes, and of course there was no osteoplastic changes either. So in some way the pranayama does help to for the new bone formation, because at least the blood changes which come, those are favorable for the osteoplastic activity.
So, Dr. Saab, there is one question here. Can I
Yes,
ask?
yes.
So apart from pranayam, what else helps to preserve the bone density? Pranayam is good, like you do, like Anulom Vilom, Kapalabhati, Brahmary, and all. So in addition to that, what are dietary or some other things which we can incorporate in our day-to-day lifestyle?
Dietary, I mentioned that is a good protein food. An average person needs 1 gram of protein per kilogram body weight. If you are weighing 50 kilogram, then you need 50 grams of protein, or approximately half a gram protein per pound of body weight. And vitamin D, and somehow we Indians are lacking vitamin D.
That's true.
They say that you sit in the sun, the ultraviolet rays make the vitamin D, but that is only true in the white skin. In the brown skin and the dark skin, the vitamin D is not formed by the ultraviolet rays. And it has been proved it, and actually they did some tests it was about 5-6 years ago. The lowest vitamin D level was found about 5 to 9 units among the Indians radiologists working in Manhattan. That was, the paper was written that, so that 5 to 9 units in physicians, radiologists working in the Manhattan, Indians. So somehow we have to take the supplement vitamin D. It should be, level should be, they say between 30 to 100 units, but good will be at least 50 units. It's not units, I'm sorry, it's nanograms. Nanograms, yeah. Although the vitamin comes in the units, but they estimate they do it in nanograms.
So, Dr. Gandhi, just one question: how much vitamin D should we be taking on daily?
Again, it depends upon your blood level. If you should get the blood level, I will say at least once a year. And if it is below 30, you should take between, I will say 25 and 30, that you should take 2,000 units every day. If it is below 25, then I will say you take 5,000 units. And if it is like I gave the example of the radiologist, is 9-10 unit nanograms, then you have to take 50,000 units.
Got you. Thank you.
And Dr. Gandhi, does the Indian food, the normal vegetarian, healthy Indian diet, has enough protein, or you think extra protein should be taken?
Depends upon what diet you take it. If you are taking plenty of beans, chickpeas, and pulses, and those have a reasonable amount of protein source. And of course, milk and milk products.
So, Dr. Gandhi, we have heard like milk and milk products are not good after a certain age. What is your thoughts on that?
From where did you hear that? That's news to me.
I have been hearing from different theories that comes out every time, and they say, hey, after a certain age, you should not be taking milk and dairy products, avoid dairy. And what I'm hearing from you, milk and milk products are good source of protein and one should take it because depending on our weight, we have to take 1 gram of protein per pound or
No, per kilogram.
per kilogram. Yeah, sorry.
Oh, I never heard. That's a news to me that the dairy products are not good for us. That's not true. And the other source of good vegetarian protein is the soya. Soya beans or tofu or tempeh, so those things are good.
I have a question. Is there too much of vitamin D? Like if you take too much of it affects? Is there an adverse effect of taking too much of vitamin D?
So far, no adverse effect has been noted with vitamin D, excess vitamin D.
Thank you.
Okay, now this was about the diet to prevent the osteoporosis. Now the exercises, the general exercises are you have to build the muscles. So that there is cause the traction on the bone, and that stimulates the bone formation. For that, in the yoga is all the exercises, the postures which are standing postures. Those are good. And otherwise, the other exercises, of course, jogging, running, or walking, or the strength training, then the weight training, those exercises to be done. Now, when you are doing the aerobic exercises, running or walking, or even strength, you have to watch your pulse rate. That has to be careful, especially for the seniors, that how we know that how much pulse rate or the heart rate can go safely. That is an arbitrary figure of 220 minus your age. If you are, say, I'm just giving the example, 80 years old. So 220 minus 80, how much is 160, 140? So that is your maximum pulse rates can go. But you should never go more than 90% of this. So 220 minus age and 90% of that, if you are healthy, you can go up to 90%. But if you have some heart condition, blood pressure uncontrolled, then do not go beyond 70% to be safe. Of course, check with your physician. So that is. Now coming to the back pain. Back pain is one of the commonest ailment in all the Western countries, especially civilized countries, so-called civilized countries. And about 30% of the population at any time have the back pain. In the United States, I'm talking about United States. 30% of the population at any given time has the back pain. And almost, I will say, between 95 to 100% of the population, one or the other time, has suffered from the back pain. The expense to treat the back pain in the United States per year is somewhere between 80 to 90 billion, be like boy, billion. That is to treat the back pain only. And what is the cause? There are many causes, but here I'm going to not talk to all the causes, but main cause is the imbalance between the abdominal muscles and the hamstring muscles. Hamstring muscles are the muscle of the back of the thigh, and the abdominal, of course, the front of the abdomen, these muscles. When the abdominal muscles are weak, let me retreat a little bit. When the baby is born, baby has two curves in the spine. The spine is not straight. There are two curves. One is the chest curve, which is a concave in the front, and the second curve is in the lower part, what we call the sacrum, or the lowest part of the spine. That is also concave forward. And as the baby starts lifting the head up, then the curve in the neck appears. That is a convex in the front. And as the baby starts taking few steps, then the fourth curve appears in the lower back, or what we lumbar area, which is also convex on the back. Now there is no definite degree of these curves measured, but when the abdominal muscles are weak or the hamstring muscles are very tight, it either increases the curve or decreases the curve in the lumbar area. And when that curve decreases, the line of gravity for the posture changes. Now, the line of gravity of the changes if you stand straight, and if you put a what you call plumb line from the middle of the ear, it would go through the middle of the pelvic area, then the middle of the knee, middle of the ankle, and that. If that line changes, then you are going to have a back pain. So to correct that, you have to make the abdominal muscle strong and stretch the hamstring muscles. And that's what the yoga does. Most of the posture, if you see, they make the abdominal muscle strong and stretches the hamstring muscles. Now, coming back to pranayam, also there's these two pranayam, the Kapalabhati and the Bhastrika. Again, it should not be done by everybody. That is why I did not mention earlier, but they are a good exercises, or the pranayama exercises to strengthen the abdominal muscles.
Dr. Gandhi, it is really helpful how you explained it medically, what happens to our bones and why these pains all of a sudden appears. So very, very helpful. Thank you. I have one more.
Yeah, I agree.
Yeah, extremely.
I didn't know that the abdomen and the hamstring are linked to that.
So true. So true.
That's the question. Repeat the question, please.
No, I was just saying whatever you just talked, it was very informative and very eye-opening, like how the body changes and why all of these things make so much of difference as we age.
That part, I heard you. The other lady.
Yeah.
Priyanka.
Oh, I didn't have a question. I was just agreeing with her.
Oh, I see. Oh, I thought you had a question. Okay.
I have one more question.
Yes.
Dr. Gandhi, about calcium. So we also talk about calcium is an essential thing to take for bone health.
Yes.
So could you please shed some light on that one?
And if you are taking a reasonable amount of milk and milk products, the yogurt, cheese, milk, you do not need any calcium supplements. But if you are lacking that, or just like the other said that it is not advised to take the milk, so then you have to take the calcium supplements. And the best supplement to take calcium is calcium citrate. And also in the osteoporosis, I mentioned vitamin D and calcium, and you have to take the magnesium also. Again, magnesium citrate is the best.
Dr. Gandhi, I do have a question about the milk thing which Neeruji asked. In US, we've really heard that there is a lot of processing of milk happens. So a lot of chemicals are added during the processing. There is 1%, there is 0%, there is goat milk, there is almond milk. What milk do you suggest for healthy bones?
I don't know all these chemicals, but personally, I recommend organic milk. That is your choice. You want 1%, you want 2%, you want whole milk. That is your choice, whichever you want. But I suggest organic milk.
Okay. Thank you, doctor.
You're welcome.
Question, what should we avoid in our diet to maintain healthy bones?
What should avoid?
Yes.
Nothing to avoid, eat everything and just have these proteins, vitamin D and calcium.
Thank you.
You're welcome.
I have a question for Dr. Gandhi. Yeah, I have a question. You mentioned that we have to avoid, like due to some medical conditions, we have to avoid doing the Bhastrika and Kapalabhati. Can you explain me what type of conditions patient has it to avoid? And another question I have is sometimes doctor recommend to take calcium, zinc, and magnesium.
Taking the calcium and magnesium and zinc, that is fine, but they do not take excessive amount of zinc.
Okay.
And as far as the conditions which you to avoid, the Bhastrika and Kapalabhati, that I already mentioned, if you have a glaucoma or any other significant eye problem, high blood pressure, uncontrolled heart disease, hernia, and prolapsed uterus. Those are some of the conditions in which you should not do the Bhastrika and Misra.
Thank you.
Any other question?
Dr. Gandhi, go ahead. Ragini, go ahead.
Yeah, I'm going to go ahead. I forgot the question.
You forgot
I'll
the
come
question.
back. Yeah.
Okay, let me ask then, meanwhile, mine is a quick one. Dr. Gandhi, you mentioned about the organic milk. So should it be A2 or just any organic milk is okay?
Can you get the A2?
Okay.
Can you get it?
A2, yeah, A2 is available in certain places.
I don't know if it's available.
We
I take whatever I can get. So
okay.
I mean, A2 is good, but I don't know whether A2 is available.
A2 is available if you need it.
Costco.
From certain grocery stores, it's available.
No, I'm not going to searching for the grocery stores.
I believe Whole Foods has it.
Is it?
Costco has it.
Whole Foods, Costco, most of the big stores have it.
I don't know it.
But is A2 organic or not organic?
has to be organic. I don't know which is available is organic or no. I don't know.
Because it doesn't say
I don't know
organic.
whether it was available anywhere. So.
Yeah, but it doesn't say organic. So I just wonder if available A2 milk is organic.
You're better off with organic then.
Any other question?
Yeah, I have. What's the difference between astroarthritis and astrophorosis?
No, repeat the question, please.
Astroarthritis
Osteoarthritis.
and astrophorosis.
Osteoporosis is the lack of bone. The bones become, as I said, is eaten by the old bone is eaten by the osteoclast cells, but the new bones is not formed. So that becomes the less bone, less density, and softer bones, and what we call fragile bones. And you are likely to get the fractures. And osteoarthritis is the arthritis of the joints, that the inflammation of the joints because of the aging, and there are various other causes, aging, the obesity, and overuse. So that those are some of the causes. And usually osteoarthritis happens in the weight-bearing joints, in the hip, knee, ankle, those.
How do you correct it?
Lose weight and do not misuse the joints.
Dr. Gandhi, quick question.
Yes.
Yeah, I mean, usually, the food intake is relatively important, but besides that, genetic hereditary stuff comes in a picture, like the formation of the body and how the body grows and how the bones and muscles forms and everything. Some people, they just born, and they're always gonna stay skinny. Now, I'm just coming to the question that relative to the body issues. Keeping the food aside, how do we, correct it, or at least become a problem free?
What do you mean correct the body?
I mean, how do you maintain, or maintain the good, the body in a way?
Proper lifestyle, good lifestyle. And that includes the diet, the exercise, socializing. Those are the important things. Now in this corona business, I am sure almost everybody has gained some weight because there's no socialization and just eating and lack of exercise.
I see. But I mean, the big picture comes in in a way that, the genetic or hereditary, a lot of people, have the bad back or, bad posture or bad, the group of the muscles or the bones. I mean, it's kind of hard to improve on it.
The genetics can't be improved. That is, but you can overcome them or modify them by proper exercise, diet, and lifestyle.
I see. Okay.
This is Dinesh. Is glucosamine useful for the joints?
What?
Glucosamine, you usually hear about taking glucosamine.
Yeah, glucosamine and cosamine.
Yeah. Are they any useful?
If you have early to moderate arthritis, osteoarthritis, not rheumatoid arthritis, only for osteoarthritis, yes, you can, it is good. But you have to be careful. If you are diabetic, then your diabetes will increase.
I have a comment, Dr. Gandhi. Correct me if I'm wrong. Talking about pranayama, we can practice, more or less as we find it necessary. However, when we do Ujjayi breaths, if we can learn abdominal breathing, that has the biggest benefit, because then it should become second nature to us to breathe through the abdominal, or do the abdominal breathing rather than chest breathing.
You're right, and that is why in my class, the first lesson, which I spent almost 2 weeks just teaching the abdominal breathing, every day abdominal breathing for 2 weeks. I do not teach anything.
You know, because why I mentioned most people do not recognize that.
No, abdominal breathing is very, very important.
Right.
That is basics of pranayama.
And the simple exercise that you had given us at one time, whether you think it's appropriate at this time or not, is very beneficial. It gets into, everyone to do it and then progress through it, and so that it becomes second nature. Like now, I do not do chest breathing. I will always do abdominal breathing. Even when I am not conscious, I'm doing abdominal breathing.
I remember when you joined, you were doing the thoracic breathing. I remember that.
Dr. Gandhi, I have another question. You mentioned about glucosamine recently to a question that if you are borderline, diabetic, something, you should avoid it. So, and about the exercises, running. So if there are knee cracks while running, what remedies would you suggest if instead of glucosamine? To keep knees healthy while, so that somebody can run constantly for a longer period?
My first question is why you want to run?
Well, it's an exercise.
As an orthopedic surgeon, I never recommended jogging or running unless you are chasing somebody or being chased.
So
I
thought it's good for cardio.
Benefit.
It's good for cardio, right? I mean, running.
Yeah, the cardio benefit, you can get the same benefit by fast walking and then running or jogging, but minus the injuries.
Any last questions? So we're gonna wrap up the
Can you
session.
find this is Dinesh again? Can you find D5, D3? Usually you get a vitamin D in a D3, right?
Is it D3? Yes.
Yeah, D3 is made with animal bones. So D5 is the one made with the vegetables, but it's hard to find that.
No, D3.
Dr. Gandhi, I have a question.
Yes.
Instead of having separate vitamin like C, or if you have a multivitamin, will that be good?
That is not, in that is not enough vitamin D, especially if you're talking vitamin D.
Okay.
That usually contains about, I think, 500 units or something like that.
Okay.
Vitamin D you have to take separate because you need in a bigger dose.
Okay. Thank you.
More questions?
I just want to thank you so much. It was very informative. Appreciate your time and answering a lot of questions.
Hi, Dr. Gandhi. I have a quick question.
Yes.
So when I try to climb the stairs, I have a creaking noise in my knees. Sometimes I hear that, sometimes I don't. I'm not sure, is it because of the osteoporosis or is it like the way I'm stretching the knees? Is that creaking sound is bad for you?
It's not osteoporosis. That sound is because of the osteoarthritis. And that tells that your muscles at the front of the thigh muscle, the quadriceps, is weak. So you have to strengthen those muscles.
Okay.
If anybody has arthritis, if you can keep the, whatever joint it is, if the muscles around that joint, if you can keep them healthy and strong, the arthritis pain will become less or even
I think Steve G has some question.
Yeah, how much time should we wait after finishing pranayam and eating breakfast?
There's no definite, I mean, 10, 15 minutes, fine. After it is not the problem, is the before. Before it should be empty stomach.
Does that answer, Steve G?
Thank you.
Anyone else? No? So Dr. Gandhi, Dev Yoga really appreciates your time and really thankful to you. I think it was very informative and everybody definitely learned something out of it. I personally did a lot of stuff today. So thank you so much.
Thank you.
Devji?
You are welcome. It's my pleasure to help anybody.
Yes. Yeah, Devji.
Well, I don't know how to thank enough to Dr. Om Gandhiji. And we will continue and we will invite you again so everyone can benefit. And next month, we will have Dr. Pankaj Patel. And he will be talking about the pain in your body. He'll be talking about the psychology and also the philosophy. So that will be also an interesting topic. And thank you, everyone. This lecture of Dr. Om Gandhi will be available on Dev Yoga YouTube channel. I will post it tonight. So like Dr. Ramesh Gandhi's, I see very lot of people overwhelmingly watching that, viewing his lecture. Same way, I will post Dr. Gandhi's, Om Gandhi's lecture as well. So you can watch him, talking him, you can hear him again on Dev Yoga channel. And thank you very much. Appreciate your time. And thank you, Om Gandhiji again.
Thank you, it's my pleasure.
Thank you, everyone. Thank you. Thank you, Dev. Thank you. Bye.
Thank you.
See you next month.
Thank you.